Hi everyone, I'm Dr. Joy and today I would like to discuss about the carpal tunnel in the context of the boundaries, contents and the clinical application. Yeah. So first of all, I would like to draw the distal row of the carpal bones. Okay, so this is your trapezium, trapezoid, capitate, hamate, and this is your hook of the hamate. So this is your ulnar side and this is your radial side. So if you can see these carpal bones, it forms an anterior concavity, correct? It's concave, okay? And there's one more structure which attached to the hamate and also the trapezium, and this is called as the flexor retinaculum, or another name is called as the transverse carpal ligament. Okay, so when this therefore is going to convert this region here into a tunnel. Okay, so and this tunnel is called as the carpal tunnel. So therefore the boundaries of the carpal tunnel is anteriorly you have the flexor retinaculum or the transverse carpal ligament, and posteriorly you have the carpal bones. Next is the contents of the carpal tunnel. There are three main contents. The first one is the tendon of the flexor compartments. Okay, so what are the tendons? So first you have the tendon of the flexor digitorum superficialis. Next you have another four more tendon of the flexor digitorum profundus, and one more tendon of the flexor pollicis longus. So all these 9 tendons are the first contents of the carpal tunnel. Now the second content is the synovial sheath. Okay, so the tendon of the flexor digitorum superficialis and the flexor digitorum profundus, okay, it is covered by a synovial sheath called the ulna bursa, and there is also another synovial sheath which is not sharing with the other tendon, and this is called the radial bursa, and it only covers the tendon of the flexor pollicis longus. So this synovial sheath is the second content. Now the third content, which is the most important one, is the median nerve. Okay, so median nerve is the third content of the carpal tunnel. Okay, so what are one of the usual clinical presentation, clinical condition related to the carpal tunnel is the carpal tunnel syndrome. Okay, so this happens when there is a decrease in size of the carpal tunnel, or there's an increase in size of all the structures inside the carpal tunnel. For example, let's say during the pregnancy, usually water retention will cause the decrease in size of the carpal tunnel, or when there's the inflammation of the synovial sheath. Okay, so that will cause inflammation, and therefore it will and all these conditions it will easily compress on the median nerve. Okay, so when this happens, so patient usually will have a numbness on the lateral 3.5 of their digits. Okay, but their palm area, or in more specific, the region here called the tena eminence is not affected, because the branches of the median nerve, which is called as the palmar cutaneous branch. Okay, so here this is the palmar cutaneous branch of the median nerve, is outside. Is outside the carpal tunnel, is not the content of the carpal tunnel, and therefore the patients won't be having any numbness on the tena eminence region. So that's all from me about carpal tunnel. With that, I thank you.